Hello and welcome. You're watching Medically Speaking on NewsX and I'm Meenakshi Preti. I'm being joined by Dr. Ravi Kant Arora. He's Senior Consultant of Surgical Oncology at the Fortis Hospitals in Faridabad. Good morning, sir. Thank you for joining us on NewsX. My very first question to you. When we speak of cancer and cancer survivors, help us understand, when does the journey end? Because many of us think that, oh, all right, someone who gets cancer, gets radiation, they get their therapy, and then they can go back to their lives on day two as normal. But that's not the case. It's a longer journey. Help us understand the trials and tribulations which a patient has to face. And what are your suggestions for the survivors of cancer, sir, on a big day like this?
That's a very, very nice and important question, Priti. Now, the first of all, when a patient is diagnosed with cancer, then in the Indian context, the whole family is diagnosed with cancer. Let
Yes.
us first of all understand that. And some of the cancers, they involve treatment in the form of surgery. They involve treatment in the form of chemotherapy following surgery, or involve radiation also after chemotherapy and surgery. So it's a long haul. And then once the treatment is completed, there is a follow-up period, which can be around 5 years or maybe around 10 years. For breast cancer, we have 10 years. Some of the other cancers, we have 5 years. So now, this is a very, very long haul. So, the journey starts from the diagnosis and continues till the follow-up completes for about 10 years. And once it is about 10 years and the patient does not have any kind of problems on follow-up, then we can say that, okay, she is a cancer survivor and she has survived the ordeal of developing cancer.
So, you spoke of once a person diagnosed, you said the whole family is diagnosed. Let's talk about it, especially in the context of women, because I believe you really wanted to highlight that. Tell us a little more really about, the journey from diagnosis to, of course, the end of the follow-up procedure, especially if it is a woman who is diagnosed with something, say, like breast cancer, which is so common in our country.
Yes. See, women are the very important unit of our primary thing that is called as family. And besides being the homemakers, they are sisters, daughters, they are daughter-in-laws, they are mothers. And that is one of the reasons that the whole family in India gets affected if a woman gets affected with cancer. Now, it works both ways. If a woman gets affected and is treated and involves treatment for cancer, then the whole family gets affected psychosocially, emotionally. And the other way is that if the women are aware, they are able to, educate and teach maybe 5 more women, maybe their daughters, maybe their sisters about cancers in women. So that way we can, that way we can prevent some of the aspects of cancers and have early diagnosis of cancer.
You're speaking about prevention and knowledge. Is that the key really to saving ourselves from cancer? It's something which maybe one cannot help getting, but end of the day, early diagnosis, that is extremely significant, isn't it, sir? Help us understand the significance really of the knowledge around cancer and how early diagnosis can help a patient, sir.
See, that is one of the focus areas where we oncology people stress upon, because if a patient is aware and knows about the symptoms and symptomatology about cancer, and especially in women, where the breast cancer is one of the major cancers, and just to highlight, about 1 in 28 women will develop cancer in India, and 1 in 53 will develop cancer of cervix in India. So breast cancer is primary, cancer of cervix, cancer of uterus, cancer of ovary. So these all form a gamut of cancers which can affect women. And if they are aware of what is the symptomatology and how they can be, diagnosed, make a self-assessment that they are suffering from something which could be as serious as malignancy. So let me just highlight some of the few very salient features. Now, if we talk of breast cancer, then if a lady has nipple discharge which is of watery nature or of bloody nature, or she has a lump in the breast, or she has a lump in the armpit, or she has a lump in the neck area and the supraclavicular area, then these are some of the features that that should make a woman aware that, well, something is not right with her. And in that end, there is a thing called as self examination, and women can do that self examination if they are less than 40 and they are having their periods. They can have after the period ends, within the 4 days after the period ends, or if they are postmenopausal, when the period is ended, they can fix one date, and they can learn breast examination. They have to do it in front of the mirror. They have to do it lying down or in the shower. So that is one aspect, very, very lightly touching upon breast cancer. Similarly, if any woman has stopped her periods and is beyond 50 years, she's postmenopausal, and if she develops some kind of spotting, if she develops some kind of a discharge or some kind of a bleeding from her vagina, then that is again a very, very important aspect that she does not need to ignore it, because some of the women tend to ignore it. They think that it's one of the aspects and the period have stopped and this is just one interval sign sort of thing. So that should not be ignored. It should be not taken lightly. So
And we're speaking of survivors of cancer. The big thing is, how do you manage your emotions? Because you rightly said it's an emotional turmoil and emotional upheaval, not just for the person who has been affected with cancer, but for their entire family. And end of the day, counseling, therapy, that's not something which is very common in our country, isn't it?
yes. See, the thing is that besides being aware of how to diagnose cancer and how to reach early to the healthcare professional, it is also very important to understand how it is treated. Some of the women, I mean, it's a very natural thing. Body image is a very important thing. Hair is a very important thing. And they are afraid that if they develop breast cancer, maybe the breast would have to be removed. So awareness regarding the treatment aspect is also important. And if we are able to send out this message that if they come early to the healthcare professional, then the breast can be saved, the treatment is not prolonged, mutilation is not there, cost is not much, you go back and join your life and your work, and you don't lose your man hours, and you come back into your normal life early. So then they still feel, okay, well, if I have developed this problem, let me go and consult a specialist, and maybe things would go fine in the end. So this is also a very important aspect. And in fact, let me also emphasize here that they should not be afraid that the breast is going to be removed. We have a lot of techniques now. We can mark the tumor by silver wires, and we can do a mammogram. We can see where the lump was existing. Once we give chemotherapy, if the lump vanishes, we can remove that area. We can only do the axillary clearance, and we can save the breast. We can also do some breast reconstructive therapies. Oncoplasty has come. So talking of breast, these are some of the things
Yeah.
that we need to understand.
And
So
you, sir, point taken. It's a very pertinent point which you raised, sir. My last question to you, before that, sir, if you could just move a little left, your face is getting cut. Yes, we'll just cut this part out because it's recorded. Yes, sir. So my last question to you, why is it so important that we celebrate Cancer Survivors Day? End of the day, these days are also significant, isn't it? Because they celebrate and inspire others also. Not only do they celebrate the survivors, but inspires others and sort of builds a whole community, because emotional support also very, very important for cancer survivors. Being diagnosed with cancer itself can be earth shattering, really, to say the least, for a family, isn't it?
yes, that's absolutely true. And why we use the word celebrating cancer survivors is because they are the link, they are the narrators between the treatment team as well as the people who have been treated. Now, someone who has, gone through the ordeal of getting the surgery done, getting the chemotherapy, getting the radiation, and she is now 4 or 5 years into it, and she's enjoying her life. She's absolutely normal. Now, these are the right messengers in the society. They can go and encourage other women if they are if they have a diagnosis of this kind, to go ahead and get the treatment done early. So that would decrease the load, the disease load in the society. of late breast cancer. We need to catch them early. So they are the, whatever I may say, patients or the people or the women out there may not believe. But if somebody who has passed through the ordeal goes out and tells them that, yes, see, I have done it, you can do it. So that is the most important thing. And that is why we involve a lot of people to come forward who have, survived from this ordeal and come ahead and tell their stories. They shouldn't hide themselves. They should come out and tell their stories.
Absolutely. The testament of the survivors, very, very important. It gives courage to others. It builds a community. End of the day, we need to speak out, encourage, of course, everyone to get early diagnosis, because that really is the key to recovery. And as you rightly said, Dr. Arora, we need to reduce the load on the system. And that can happen only when people are forthright and they come forward and get treated at the earliest. We do hope that by this telecast, we've been able to do some public service and spread some awareness. And hopefully, people do take your suggestions very, very seriously. Self-examination for women, very, very important. Thank you, sir, for joining us on NewsX and talking to us.
Thank you. Thanks.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.